Hi, I'm Trish Caldwell. I'm the Senior Vice President of Clinical Services at Recovery Centers of America. Today, I am going to be talking about trauma and substance use. I have been in the field for roughly 27 years. And over the course of my career, I have worked with individuals who have been impacted by trauma in ways that they didn't understand how it impacted their substance use. Today, we are a field that understands the importance of science, evidence-based care, and integrating the treatment modalities for both trauma and substance use. And that when we treat both simultaneously, we see greater recovery rates. So I'm going to start having a conversation about how we understand the brain and the experience of trauma and how those experiences and the impact it has on the brain impacts the substance use disorder, and then how we begin to move through treatment options to help support long-term meaningful recovery. Most trauma and substance use treatment will acknowledge that trauma has impacted substance use, but not necessarily integrate how our understanding of the impact trauma has had on an individual impacts recovery. So when we look at most clinical programs address trauma or substance use, but typically not together. The majority of individuals with trauma or PTSD and substance use disorders do not oftentimes receive trauma-focused treatment. In order for us to be able to begin to understand how we as providers can change the way that we treat individuals, it's incredibly important for us to understand the behaviors associated with an individual that's been impacted, as well as opportunities for us to change the way that we treat them. A phrase or a quote that I feel resonated in an understanding of the experience of our patients, because I think this is a shame-based disease. Trauma is an experience that oftentimes also sits in the secrecy, and so part of treatment has to be opening up opportunities for people to be able to step into the light, share their experiences, and learn how their experiences in life have impacted where they currently are today. There is a treatment approach called Seeking Safety, and in that they quote, "Substance use is the scab trying to protect the trauma." When we think of what that means, depending on the level of care that we are serving an individual, if we think of what that actually means from a medical standpoint, if you've ever had a scab that you have opened up, you would expect to see what was underneath. If you rip off a scab, you would expect to see it being vulnerable, raw, messy. You wouldn't be shocked, you wouldn't be disgusted, and you wouldn't be alerted. You would go, no, that's what I expect. We opened up a scab, so I expect to see what's exactly underneath there. When we think of how this relates to trauma and substance use, the brain, and we'll talk about that in a couple of minutes, the brain, when it is triggered, doesn't decide what's good or bad, right or wrong, moral or immoral. The brain in a triggered state decides, did it work? And for somebody that has been impacted by trauma, who has experienced flashbacks, unyielding anxiety, dysregulation, feelings of hopelessness or sadness, and they use a substance, their brain says, that worked. And so when they experience things that are similar, their brain starts to say, you know what to do. As providers, we need to understand that. So when somebody comes into your treatment and they show you the signs that they have been impacted, we're not surprised. Imagine if you went to a practitioner after having ripped off the scab and they seemed shocked. They were like, oh my gosh, why does it look like that? Why are you bleeding? Why is it so messy? Imagine the fear that you would feel if the professional felt this was not normal. When we start to talk about the symptoms, which we're going to do in a couple of minutes, it's incredibly important for us to recognize that when we see the symptoms, we acknowledge it. That's why you're here. Makes sense. That we have taken off the scab, and while we might need to, because we might need to go in a little bit deeper and clean out the infection, we should still expect what we're about to see. We are not in a position of condoning or condemning behaviors. We want individuals to understand the why to the experiences that they have so that they can better find solutions to getting well.